I'm about to head into the testing center. I'm not really sure where it is. Like, it's near like Harold's Hotel. It's called Love Yourself Cebu. I think they're this voluntary program because I think they're nationwide, since I checked the website on Facebook, and there are a lot of like Love Yourself centers, not just in Cebu. I'm really like interested. I'm like running out of breath because I'm walking. But I'm really interested in seeing what the place looks like and how the environment is. And I guess I'll update you when I get there. That was honestly like super easy. I just walked in, and at first I thought they wouldn't let me get tested because I didn't get to book an appointment. But then I walked in and they were just like, "Oh, what are you here for?" And I was like, "Oh, I was hoping I could do a walk-in testing if that's all right." And they were just like, "Yeah, okay, just fill up this form." And then I was like, "Okay, thanks." So then I sat down, I filled up the form, and they have this system where they don't call your name when it's your turn. They call your birth date, because I think it's like a confidentiality thing, since you're all in one waiting room and you don't want people to hear your name. So they call your birth date, and that's when you come in, and they sit you down, and they start to counsel you inside like a closed room where they get you tested. And I was supposed to film the testing, but they said that it wasn't allowed. But they were very informative. They answered all of my questions. They talked to me about PEP and PrEP, and I'll expound all about that when I get to talk to Bragat and Kyla and Nicole. But yeah, that was the experience so far. Like, I just went in, signed some forms, got tested. They showed me my results. They even let me take a picture of my results. And then I went back out. They said that since I couldn't film the process, they showed me like their YouTube channel. Yeah, that was it. It was super easy. I can't wait to talk about this with Bragat and Kyla and Nicole. Okay, bye. So I just got back, and I'm currently in this lounge. Going there wasn't really a hassle, but of course that's different for everybody. Love Yourself Cebu might not be that close to other people as it was to me, but their place isn't even that hidden, so you can you walk around and you'll see the sign and you'll know, oh, that's the place, and you can go in. And for those who know, it's like who know where Harold's Hotel is, somewhere there is Love Yourself Cebu, and it was really easy to find considering I'm not actually from Cebu. So that's great. First I was confused because there was no one in the front desk, and I just stood there like looking around wondering if anyone would help me. And then after like a couple seconds, someone walked in, and it was a volunteer, and he was just like, "Yeah, like, let's get you started. Here's your form, blah blah blah." It was all good. And while waiting, there were actually some like pamphlets and videos being shown, and like free condoms and free lube. And then I was just like, this is really cool, because like people are, oh, I should have gotten a condom. Okay, now I feel a little dumb. I should have gotten a condom so that we could talk. It's fine, we'll buy a condom, it's fine. Now we're here in this lounge, and we're ready to talk talk about HIV and everything there is to know about it. So with me is Kyla, Nicole, and Braga. We're all good friends, and we're coincidentally groupmates for this task. Anyway, now we're gonna talk about HIV. So does anyone have like insight?
HIV is like something that diba is sexually transmitted one, but there's like a specific way of like transmitting it to another person, like sexual intercourse, blood transfusion, like what you said, na through needles, diba? So you're not allowed to share needles with another person because you'll never know what if you're sharing needles for tattoos. I'm not against tattoos, okay, but you have also to be careful if that needle but is repeatedly used.
Yeah, because it can be transmitted through semen
Yes.
and
blood,
Yeah.
but
fluid.
not saliva.
no, apparently. I mean, I'm not sure. Like there are different articles that say it can be transmitted through saliva, and then others that say it can't. So I guess that's a question we can ask your doctor later.
Yeah, later.
And also, as what we've learned from our class, HIV is human immunodeficiency virus that attacks our body's immune system. So HIV can lead to AIDS if it's not treated.
So AIDS is like
The worst part.
advanced version
Yeah,
of
the worst.
HIV.
Like the worst part
Okay.
of something.
Like if it goes untreated. Okay. I feel like a lot of people like always interchange AIDS.
Yeah,
Like, you don't really know.
like they think na HIV and AIDS are the same. HIV is a disease, but I think AIDS is like the cancerous part. Like the deadly part na gani,
The
diba?
stage.
The stage.
HIV is the virus, well, AIDS is like the syndrome or
Yeah.
the worst part of that.
Yeah. Okay, so now we actually have people that we know who are HIV positive, and we messaged them, and we got their insight. So, wait, I believe you have someone? Yeah. So this
Of
is
course,
Yeah,
no names allowed,
yeah. We're trying to keep
We can hide their
confidential,
confidential.
but we have their permission, by the way, with talking about it in this video.
Yeah, and sharing. So, mysterious person number one.
I tested positive for HIV when I was 12 years old. Before that, I had gotten tested multiple times with monogamous partners.
What was that called?
Monogamous partners since high school and always tested negative.
Polygamous.
Monogamous.
Monogam.
So monogamous, wait, sorry to cut you, but monogamous meaning like one partner. Single partner,
Oh,
yeah.
okay. Polygamous is like
The multiple
multiple
partners.
partners.
And I had contracted the disease in my 20s. I found out that my partner got it from someone else and passed on to me. Aside
Oh,
from
so basically, the person, the partner cheated.
Yeah. Aside from testing positive for HIV at the time, I also found out I was pregnant.
Oh. Wait, what?
Yeah.
That's such.
Um,
Huh?
Yeah, so she was HIV positive
One
and
is pregnant.
Luckily, I got my daughter tested after she was born, and the result came back negative. During the time I was pregnant, I took my medicine religiously in order to prevent my daughter from contracting the virus.
okay, so thoughts about
So number one, never cheat on your partners, guys. That's the number one thing, for sure.
we need to be loyal to our partner.
Yeah, we need to be faithful.
Yeah,
Faithful.
That's
Okay.
actually one of the reasons like people say that we can do to prevent this.
Yeah, that's I think number one.
I know number one is abstinence.
abstinence.
I joke.
ABC.
Yeah, ABC.
That's
Yep.
so cool. I don't
Yep.
know that. Okay.
Yeah.
So,
So, number one insight, never cheat on your partner, especially if example, like you'll just meet this person recently, like you don't know anything about the person you're cheating with. So what if that person that you're cheating with has HIV? So you'll never know what will happen to your main partner, to your wife, let's say your wife.
But what if like we have people who are consensually in a polygamous relationship?
Like multiple partners.
Multiple partners. And it's agreed upon. Both of you are okay with it. So
Yeah, so like the best thing I think to do is to use condoms.
Yeah,
Yeah.
let's practice safe sex.
Practice safe.
Like, okay, just sex is normal. Sex is not bad. Sex is, yeah, number one, normal. Like, it's not like, it's not a bad thing. But all you have to do is just protect yourself and the person that you're having sex with. And how
oh,
about,
she even mentioned the daughter, right?
yeah, that's the worst part. That's the worst part, I think.
But the daughter came
Negative.
Yeah. So she didn't mention that she got
Wait.
took medicine.
So she got pregnant before, or like pregnant na siya.
Pregnant na ako.
Oh,
Was she like pregnant then still having sex
Yeah.
or she was like, or she was pregnant during a positive na
Yeah.
I think that was the.
Oh, okay, so the ano there is like not really not right away na kuan ba, like dili gani tanan makatagan dun o HIV positive ang baby.
No,
Not all.
because hers came out negative.
Siguro ba na
Yeah, that's what I
But
thought.
luckily, she takes medicine
Oh, yeah.
religiously. So
Yeah.
like, to
To
protect her.
protect this child. Yeah.
Like I read this thing that if you are positive and then you get treatment and you maintain that treatment, your viral load could be so low that it becomes undetectable and you won't transmit it to other people. So that's how she prevented the transmission to her daughter.
Good thing.
Yeah.
Good
It's a
thing.
good thing.
That's a good thing.
Anyway, I'm so sorry you were cheated on.
Yep.
And now,
We're sorry.
agree.
Sorry for the person that you know, Nicole. We're just sorry for her.
Okay, who knows this second person?
I think it was Braga.
Yeah. So he was a 20-year-old male. So I had always used the condom during my sexual activities. However, on one occasion, the condom broke. I
Oh.
thought nothing of it at first, but a week after the sexual encounter, I began to experience flu-like symptoms. I got tested and found out I was HIV positive. My sexual partner, whom I had encountered HIV from, was asymptomatic and had assumed she was HIV free. It was only until then when she found out she was actually positive. You can never be sure if you have the disease or not unless you get tested yourself. Since I had tested positive, I took my medication daily. Within 2 months of taking it, my viral load became undetectable.
Okay.
So it's nice that he practices safe sex.
Yeah. Just unfortunate.
So it's just it's just unfortunate lang.
And
na
to think of all the times that it broke, it had to be with so much
Yeah.
positive.
like the odds of having diba?
Yeah.
We'll never know. We'll never know what life brings us, guys. Like, just go with the flow with your life. So, but he's not HIV free. Undetectable lang.
Yeah, because you can never be HIV free after you
Yeah.
Not like COVID.
No. Yeah, because HIV there's no cure. What's interesting about this guy's story is that his sexual partner didn't even know she's
Positive.
Asymptomatic.
Yeah, I think that's what's scary, right?
Yeah, because you'll never know.
Yeah.
You'll never know. Number one, you'll never know if a person has HIV. Like, we don't know. One of us is HIV positive, but no, knock on wood. Knock on wood. Knock on wood. But yeah, by looking at the person, you'll never never know if he or she is HIV positive. So it's just basically on the symptoms lang.
For us to know, like, if we have HIV, we need to get tested.
Yeah, we need to get tested. Since talking about getting tested, we heard, that you got tested.
Yeah, just before this video or this part of this section, I got tested earlier today, and it was you who gave me the address.
Yeah, it was actually me but I never thought that you'd be so down.
I was actually really excited, and it was a fun experience. I just thought like, hey, I mean, why
not?
Yeah,
Since it's free, go.
it was really fun.
Were there like, before you went inside, before you got tested, were they like talking about like, since you're having a test for HIV, were they talking about how to prevent HIV?
They didn't talk about it while I was in the waiting area, but they talked to me about it while I was getting tested. Because when you get tested, they bring you to this closed
So,
room.
in talking about that, preventing HIV, what were their like points?
They talked about, first of all, good safe sex, obviously. And then they said that there's also PrEP and PrEP that they also offer for free for some people. Like if you can afford it, then they would ask you to pay.
Like maybe donation?
Maybe. Yeah. But if they assess that you aren't as financially stable, then they'll give it to you for free. And I think that's really cool. Yeah.
So, safe sex in general, we use condoms.
Yep.
So, we bought condoms. Just to show you.
But yeah, that's true.
Just to show you.
I think we'll move on to that in a bit. I think we should talk inform people the process and how you get tested.
Oh, sure.
Okay. So after they ask you to fill in the form, they're just details about your last sexual experience, how many sexual partners you've had, does your mom have HIV before you were born, blah blah blah. Other questions questions very related to how you might
Have HIV. Like the possibilities.
Yeah. And they have this cool system if you feel like you're too ashamed to let people know you're there.
Yeah.
They sit you down and they say, just wait until your birthday is called. So they don't call your name. Yeah. When you sit down and you hear your birthday, that's when you stand up.
For example, all of us here. I mean, I don't know any one of your birthdays, but like October 8th.
What if we have the same birthdays?
Yeah, what if
Good year, I guess.
Oh, yeah.
That's so weird.
That's true. Yeah,
But it's nice. It's nice, especially when you're surrounded with people that you don't know. Because, okay,
To hide your...
to hide your identity, still, if it's, you're trying to normalize the things that, example, this one, getting tested for HIV. Still, if you're asking someone to get tested, it feels like being ashamed of it.
Yeah.
People will look on you where is he getting tested, diba? So, might as well, no, don't judge me na
Yeah, that's true. And what if you hear a last name and you go, oh my god.
Familiar, like that.
Yeah.
That's a nice way. That's a nice way of hiding the person's identity.
And while you're waiting there, they actually show videos on how the process is done. Blah, blah, blah.
Process of what?
Process of getting tested.
Oh, okay.
Yeah, because they have videos they have a YouTube channel apparently.
So subscribe to them. Link down below.
And they just, while you're in the waiting area, there are a lot of informative pamphlets and free condoms and free lube and everything that there is to know, right? And then you finally get tested, they call your birthday, and then they bring you to this room, and then they ask you simple questions like, what brought you here today? Why are you getting tested? And then you just say, it was really funny because I went there and I was just like, this is for a school project. I have no other reason of being here. I know I'm negative.
But still, you were like very excited.
Yeah.
Diba?
It was really fun.
Still knowing na
I
you'll
think
be
the
there.
only reason why I was not nervous is because I know I'm
You're
negative.
negative.
Can you imagine going there thinking you're positive and you're just like sitting there like, oh my god,
Oh
positive.
God.
Yeah, it will be like, I think you're positive now because you're thinking na you'll get a positive result.
Yeah.
Okay.
Well,
So mindset din
Yeah.
during the test.
Yeah. And then he just spoke to me about like condoms and PrEP and PrEP. And I wasn't really sure what it was about. So I asked him what PrEP and what PrEP was, and he was saying PrEP is, he described it almost like vitamins. So it's something that you take regularly, yeah. And PrEP is usually before the sexual act. So he
Wait,
said
that's for prevention, right?
Yeah.
Okay.
I think you can, like in the name PR, prevention.
Yeah, pretty
Prep and what? Prep.
PrEP, PE.
prevent.
What's PE?
I don't really know it. You should look that up. We'll insert it here. That's what PrEP means. This is what PrEP means. But
Okay.
yeah, he said that PrEP, you usually advisedly take it regularly. So even if you aren't expecting to have sex or any form of sexual act, just take it. But if for some reason you can't do that, take it regularly, then if you have scheduled sex, you take 2 tablets before, and then you follow by taking 2 days for the next 2 days after. So then you take like a total of 4
Or
tablets.
tablets.
And then for PrEP, it's like an after thing. So if you have sex with someone and you go, I don't think this person was HIV negative, like maybe it was a little, or maybe you knew they were positive but the condom broke or whatever,
And you feel something off that whatever.
then you take PrEP.
You trust your instincts, guys.
True.
That's number one also.
Yeah.
Like, you'll never know, but in having sex, maybe in having sex, you'll never ask the person,
Yeah.
example, are you HIV positive? Are you safe to have sex? Diba?
Like it's
So
not
maybe
like-
it's nice na lang at first na to trust,
Yeah.
no, not to ask. Like,
To know
I
your
think-
partner.
Huh?
You should know your partner.
Yeah, number one, you should know your partner as well. But for some reason, like, still, we're not like in that level, we're comfortable enough to ask the person. So just try to protect, not try, just protect yourself lang if you're not yet comfortable of having unprotected sex. Let's say.
And then I asked like, oh, how long does it take for the results to come out? Because we had a class, right? And this mentioned that it takes a while.
Yeah.
Yeah. And then when I got there, I was like, I actually have a question. He was like, yeah, go ahead. And I said, how long does it take for me to know the results? And he was like, you'll probably know it in like 40 minutes. And I went, oh, are you serious? And he was like, yeah, you just sit here and then before you leave, you'll know. And I was like, okay, that's really cool. So it's just a little like prick. So even if you're afraid of needles, it's literally just one, and then you're done like CPC. That's it. That's literally it. And it doesn't even hurt. Like when he pricked me, I just went, huh. I didn't even flinch. Yeah,
Oh, you were just like,
yeah,
you were looking at it?
yeah.
Gosh.
And then I just went, oh, okay, great, whatever. And then, what was the other thing I was supposed to mention? He mentioned that even if you're positive right now, it usually takes 3 months for the virus.
Wait, positive, right? You're positive.
Yeah, like HIV
Oh,
positive.
okay.
Like, for example, if I had sex with someone who was HIV positive today or yesterday, and I get tested today, the HIV virus
It's
still
not-
can't be detected.
After how
It
many
takes
months?
months.
It takes 3 months.
Oh, 3 months.
Yeah. So they actually ask you when your last sexual encounter was without a condom, and if it's before 3 months, then they advise you to come back, get tested again. If it's after 3 months and you test negative, you're fine. Like,
You're safe.
yep,
That's nice.
yep. Moving on, we have condoms, the safest
Way of
contraceptive.
yes, it's that safe. Not condoms but still break.
Yeah,
Like,
but so
Like-
far,
like person mysterious number 2 sex. But it's the cheapest way. Number 1, it's the cheapest way. You can buy it at pharmacies, convenience stores, 7-Elevens, everywhere. It's over the counter. It's even for free.
Yeah, for
in the testing center. But I had forgotten to get some for this video. It's fine, whatever.
Since it is for free, so I mean not for free. We bought this. It's only for 35 pesos. 35. So it's the safest way to protect yourself from getting HIV. So this is trust.
Yes.
Yeah.
Hashtag sponsor, just kidding.
This is trust.
Yeah, do we open one? Let's open it.
Yeah, let's try it. Open one.
Who is the model and who wants to demo it? You don't know the demo.
No, I don't know how to put one though. Why would I do?
Oh, I watched the video.
Okay, you know what?
Who will be my model? Obviously not a real.
I think Nicole is
Okay, next.
willing.
Please hand me your
Magical
makeshift penis.
Wait, let's ask first, Braga. What if since it's the boys who uses condom, would you like prefer to use condom during sex or not?
No, my advice is you always use condoms, especially for us males, because in order for us to prevent transmitting the virus, let's say we have HIV, so we need to use condoms. Whether you have HIV or not, it's better to practice safe sex.
So let's not damay.
Yeah.
No damay allowed.
Also, you're protecting yourself. If
You're
your
protecting
partner-
yourself,
Yeah.
your partner.
Yeah.
So
If you don't have, yeah, it's a win-win situation if you use condoms.
Exactly. Plus, if you don't want to have kids yet, you don't want to get to go further. Same thing. So it's a kill two birds with one stone.
Killing 2 birds with 1 stone. That's right.
Yeah. Okay, anyway, with opening a condom, I saw that, you know how people sometimes bite it and they just
Yeah.
it's not advisable because you might bite
Really?
the condom.
Yeah.
Oh,
Yeah.
okay.
So when you open it, always make sure to open it with your fingertips, not even nails. If you have long nails like me. Just
So don't open it
no, you can open it, but don't
with your
use-
thumb.
Yeah, with your
Not with
Here,
this.
here, come.
open. So when you open it, fingertips, ta-da. And hello model, this is our very lovely model. You take the condom out, and when you pull it, you make sure that you don't use your nails. So always fingertips because your nails are sharp. First step, checking. Second step, you have to look for which side it like rolls
Down.
Yeah.
Oh.
So you look for this. You can see just by looking really closely, right? So I can see that this now rolls down. And now you pinch the tip before you put it on. And then from there you like put your fingers on it. From here, while pinching the tip, you just roll.
It's not roll. Oh.
And you're supposed to have that little gap here because when they ejaculate, you
Yeah,
have
the
some
semen.
space.
No.
That's it. Now I want
See,
to.
it's easy
That's
and
true.
it's cheap and it's safe.
Buying drugs is more shameful than buying
Of
condoms.
course.
Agree.
Agree.
And plus, wouldn't you rather go through the shame of buying a condom than realizing now I have to go and get tested because I think I'm positive for HIV?
Yeah, so.
And I'd rather buy condoms than buying diapers and milk for my baby.
So,
Yeah.
good insight.
It's better to be safe rather than to be ashamed.
Yeah,
Diba?
that's true.
Yeah, that's actually nice.
Yeah, and I feel like we need to stop being ashamed of buying condoms because sex is completely normal. And even if we live in a very conservative country, it happens.
Yep.
You know, whether you like it or not, whether you try to prevent it, it still happens. And you might as well have people who have sex safely than secretly, and HIV just spreads everywhere. Or like teenage pregnancy, just becomes an abundant thing.
And for guys, after using condom, you need to expose your condom.
Yeah.
Agree.
Yeah.
Agree. Don't use it twice. Condom, one usage.
I really hope there aren't actually people who like reviews.
Yeah.
It's a little concerning. But anyway, if you weren't aware, at least you're aware now. Condoms, one usage. It's 11 pesos, guys, per condom.
Yeah, and if you want it for free, you can go
Yeah.
You can
ask.
ask.
For-
Even if like health centers.
Yeah,
Diba?
like
Every
in barangay, every
yeah.
barangay has
Every barangay has.
and they provide free condoms and free lubricants as well.
Yeah, so there shouldn't be a reason not to use a condom. Okay, anyway, moving on from prevention and using a condom and your treatment and stuff. We wanted to like address Love Yourself Cebu, the
Yeah.
testing center I was at.
Testing center, like
It's for free.
we thought there's not it's only hospitals who offers HIV tests. But
And, hospitals are expensive.
yeah, and we all know hospitals are expensive, even if like it's a public hospital, I think you still need to pay. But Blue here got tested for free,
Yeah, for
which is a
free.
nice
For
thing.
Yeah, everything was free.
Yeah, for
Just walked
free.
in, walked
Just
out.
walked in and then danced and then walked out. Bye.
Yeah.
So, Love Yourself Cebu is an organization here. I mean, Love Yourself Cebu is an organization here that is,
Provides free testing.
yeah, and it's also like an advocate of HIV.
Yeah. Actually, their workers are all volunteers.
Yeah, and all volunteers. So, I mean, I think there are some workers, but there are no volunteers.
But
Or-
I'm not really sure how they can have actual employees because they don't have income.
Yeah, me too.
So I think it's all very like donation based and volunteer based.
So, they are located near UP Cebu. There's a map that will show you their history. They're located near UP Cebu. You can go through Jeep, Maxim, Taxi, whatever you can. Since Blue got it for walk-in,
Yeah.
maybe try to go there, but maybe if not busy lang sila.
Yeah.
Not busy lang. So,
But they have a Facebook page where you can
yes,
set up
that
appointments.
was
Okay, wow, you guys are so in sync. Okay, anyway. Now we're gonna
Love Yourself Cebu is a safe place, guys. They will not tell someone your identity. It's like not a human diary, but it's like someone whom you can trust, even if you don't know them. They will not tell anyone about your appointments. Like the one who said, they'll call you by your birthday. That's number one. Like, oh, they really care about my identity. They really care about my security. Yeah.
And they aren't just advocates for HIV because while I was talking to the person who got me tested, he was just like, like last night we had a golden LGBTQ meetup. And by golden they mean 50 years
50
ago.
years.
Yeah. And they were all there, they were just, talking, having fun. And I felt like that's so cool because it's such a safe space for anyone of all genders, of all identities, of all ages to just go to and find solace if they feel like they can't open
Yeah,
up.
but it's not just going there and getting tested. You can also ask for counseling.
Yeah.
Diba? If you're not yet comfortable with getting tested, you can still ask. You can still get counseling for free still. For free, all for free.
For free.
And it's not just in Cebu City because Love Yourself is a nationwide thing, I believe, since they have this YouTube channel that they were showing while I was in the lab. And the person that they invited to go through the process was Catriona Gray.
Yeah, thank you.
Yeah.
It's an advocate for HIV.
Yeah, I think, yeah.
So they don't just have centers here in Cebu, I'm sure they have in Manila. Maybe there's a place where you live at. So that's great, right? Free testing everywhere, free testing nationwide, win-win situation. And now, I guess that's all we have to say about Love Yourself. we'll move on to doctors. Like my dad is a doctor. I'm gonna interview him about HIV. Everything there is to know. Everything we don't know. Because obviously earlier we were like, we don't even know what PrEP is.
Yeah,
So we're
that's
gonna
what I
ask
think.
an expert
That's
and relay that information to you, show the interview and tips here and there. And before we conclude this, does anyone have anything to add?
So, for me, I'll go first. HIV can really be prevented, guys. Number one, for condom. And then, if you are feeling something, just hit up love yourself to they'll welcome you to warm hugs. Yeah, and don't get ashamed of having sex. It's normal. But yeah, just practice safe sex. That's one thing.
also you need to follow the ABCDE rule to prevent HIV. So first, A is abstinence, B is be faithful to your partner, C is correct use of condoms, D is do not use drugs, and lastly, letter A is examine. So you need to get tested for us to know if you have HIV or not.
A, B, C, D,
Yeah, it's A,
E.
B, C, D, E.
Yeah, there.
Anyway, next, you have
All I can say is limit your
Partner.
Limit the number
of your
sexual partners.
sexual partner.
Yeah.
That's true. I mean, if you are polygamous, which is totally fine, it's up to you and your partner.
Just practice safe sex.
Just have sex. That's really the bottom line of all of this, right? Just safe sex. So, that's it.
Yeah.
I think we're
Yeah,
done.
that's it. Yeah.
Slay as we should.
Yeah.
Period. Okay, that's it. Bye, I guess. See you
Bye,
next time.
everyone.
I
Bye.
hope you guys learned something.
So, the first question is, like, can you tell us all about HIV? Just everything there is to know.
HIV, immune deficiency syndrome,
Yeah,
HIV virus.
HIV virus and AIDS.
It's
Eh?
well, what I know is that HIV is just a virus that attacks your immune system, so uh, it destroys your beta cells, so you will have no protection against uh, other diseases like that. It cannot. You mean you'll be prone to all other uh, infections, and that is the other like infections and like cancers or other sort of malignancies.
What about how it can be like transmitted or
Transmitted.
contracted?
HIV is purely transmitted by parenteral means, meaning to say there should be a transfer of blood and other body fluids from one person to the other in order for it to be transmitted.
Any body fluids? Like, what about tears? Because they're body fluids.
I'm not sure, but maybe there's some tears could be positive to the virus, but if that will be the source of the infection, maybe you need to have a lot of tears.
Oh,
You need like a pail of tears, maybe, or a glass to
okay.
splash it into your eyes, yeah, because it can be transmitted through the mucous membranes. So that's why during
Oh,
preparation you have to protect your eyes. So during surgery, you have to wear goggles to prevent splashes of blood and other body fluids into your eyes.
oh, okay. The next question is, have you had patients with HIV, and if yes, how did
Quite a
you
few.
treat them?
Quite a few.
How were they, like, in general?
Most of the patients, when they are admitted to the hospital, they were admitted for other reasons. Usually, they are admitted for infections like tuberculosis, and
Oh.
the only inkling that you will get is that why these patients will have tuberculosis when they're still very young, no? Apparently, healthy individuals, and we get TB. The TB is usually unusual. It affects not only the lungs, but sometimes it affects the other organs already. So it only shows that patient is immunocompromised. So gives you an idea that uh, he is immunocompromised. So you have to search for other causes of immune deficiency. So that's how usually ask them if they are, they are amenable to have HIV testing. But the common history that we get is we have to, in my patients, most of them are MSM, men having sex with men.
Oh, okay. So how do you treat it?
HIV can be treated with your antivirals, a combination of antivirals. For the if they have other concomitant infections like pneumonia, you have to treat the pneumonia. If it is due to your Kaposi's pneumocystis carinii, so you have to give them cotrimoxazole like that.
And then eventually, like, the treatment can lead them to just live lives as if they don't even have HIV.
Yeah, most of them will go into remission, and they can be maintained on antivirals so long as their CD4 count, their inflammatory count are still low. But once they have an elevated CD4 count, you can also stop intermittently the treatment, depending
Oh, okay. Wait,
depending
there's
on
like,
some parameters.
okay. There's one more question, mostly about the prevention of HIV. We searched about PEP and PrEP. Do you
Huh?
know anything about PEP and PrEP? Yeah. And then
I'm not
PEP
very
is post-exposure prophylaxis.
I'm not very sure with pre-exposure prophylaxis because there's no actual. I don't have adequate knowledge on the pre-exposure prophylaxis. You just have to read on that. I'm not very sure if the antivirals will work if you know. But the best for us, the best option is really for prevention of transmission.
So what about PEP? Do you know anything about PEP, post-exposure prophylaxis?
Maybe the same antivirals that you give, same antivirals, but you give it and after the exposure.
Okay. That's it.
Okay, thank you.
Thanks, Dad. Bye, Dad.